Trolamine salicylate is a medication used to relieve minor muscle and joint pain, such as arthritis, backache, and sprains. It is classified as a salicylate drug. When using Sportscreme cream, it's important to follow the directions on the product package. This medication is meant to be used only on the skin and should not be applied to the eyes, nose, mouth, or vagina. If it does come into contact with these areas, be sure to flush with plenty of water. You can apply the medication to the affected area up to 3 to 4 times a day, making sure to rub it in gently and thoroughly. After applying, be sure to wash your hands unless you are using the medication to treat your hands. Avoid applying this medication to broken or irritated skin, and do not bandage or tightly wrap the affected area or apply heat, as this may increase the risk of side effects. If your condition lasts for more than 7 days, gets worse, or keeps coming back, be sure to consult with your doctor. And if you think you may have a serious medical problem, seek medical help right away. If your doctor has prescribed Sportscreme cream for you, it means that they believe the benefits of using this medication outweigh the potential risks of side effects. Most people who use this cream do not experience serious side effects. However, if you notice any of the following serious side effects, stop using the cream and contact your doctor immediately: blistering, peeling, redness, or irritation at the application site, nausea, vomiting, or ringing in the ears. While it is rare, a very serious allergic reaction to this cream can occur. Seek medical help right away if you experience symptoms such as rash, itching, swelling, especially of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of potential side effects. If you notice any other effects, be sure to speak with your doctor or pharmacist. Remember, if you are in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. And if you are in Canada, you can report any side effects to Health Canada at 1-866-234-2345. Before using Sportscreme cream, make sure to inform your doctor or pharmacist if you are allergic to Trolamine salicylate, aspirin, or other salicylates, or if you have any other allergies. This cream may contain inactive ingredients that can cause allergic reactions or other problems. It's essential to talk to your pharmacist for more details. Also, let your doctor or pharmacist know your medical history, especially if you have asthma or nasal polyps. If you are planning to have surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Since Sportscreme cream is similar to aspirin, children and teenagers younger than 18 years should not use it if they have chickenpox, flu, or any undiagnosed illness, or if they have recently received a vaccine. In these cases, using this cream may increase the risk of Reye syndrome, a rare but serious illness. If you are pregnant or planning to become pregnant, it's important to inform your doctor. This medication may harm an unborn baby and cause problems with normal labor and delivery. It is not recommended for use in pregnancy from 20 weeks until delivery. If your doctor decides that you need to use this medication between 20 and 30 weeks of pregnancy, you should use the lowest effective dose for the shortest possible time. It's crucial to avoid using this medication after 30 weeks of pregnancy and discuss the risks and benefits with your doctor. It's unknown if this product passes into breast milk, so it's important to consult your doctor before using it while breastfeeding. When using Sportscreme cream, it is important to be aware of potential drug interactions. Certain medications may interact with Sportscreme cream, affecting how it works or increasing the risk of serious side effects. To ensure safety, it is recommended to keep a list of all products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It is important to follow your doctor's instructions and not start, stop, or change the dosage of any medicines without their approval. Always consult with your healthcare provider before using Sportscreme cream, especially if you are taking other medications. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical attention by calling 911. Otherwise, contact a poison control center for assistance. In the U.S., residents can call their local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control centre. It's important to use Sportscreme cream as directed by your doctor or as instructed on the label. Make sure to apply the cream only to the affected area and avoid getting it in your eyes, nose, or mouth. Wash your hands after applying the cream, unless your hands are the treated area. Use this medication regularly to get the most benefit from it. To help you remember, use it at the same times each day. Do not apply more than the recommended dose, and do not use it more often or for a longer time than prescribed. If you forget to apply the Sportscreme cream, apply it as soon as you remember. If it's almost time for your next application, then skip the missed dose and continue with your regular schedule. Do not apply a double dose to make up for the missed one. Keep Sportscreme cream at room temperature and away from heat. Make sure to store it in a place that is out of reach of children and pets. Do not dispose of Sportscreme cream by flushing it down the toilet or pouring it into a drain unless instructed to do so. When the cream is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.